My name is Dr. David Nye, and I would like to show you the OligoScan. This is a photometric screening device which measures the levels of toxic metals and minerals in the cells of your skin. It's a very accurate device. It is a wonderful comparison to hair mineral analysis or other methods of screening, but the information that we get from this really cannot be obtained very easily by other means. So I'm going to show you how it's done and what a typical report looks like. So now we take the patient's hand and we're going to scan 4 points. As you'll see, it's completely painless and it just picks up the photometric signals from the tissues. And then the computations get done in the cloud and we will have a look at the report now. So now that we've done the scan, we get the result within about 15 seconds. The information is all transmitted to the cloud where it goes through an algorithmic process and gets computed to give us these results. So first of all, we have a look at the minerals. This includes 20 important minerals, and here we can see the quantities of the minerals in the cells of the skin of the hand. Everything in green is a normal result. Everything in yellow is abnormal and red is very abnormal. So if we have a look at this particular person's result, we see that phosphorus is very low, silicon is very low, copper and zinc are very high. Now, silicon is a mere deficiency in the body and can be supplemented, but when we see high copper and zinc, this indicates silent inflammation and needs to be handled differently. We also see this person has a very low chromium, which could be due to sugar balance problems or stress, and needs to be handled in that way. If we go further down, we'll have a look at the remaining minerals. We see that iodine is very low. This is a very common deficiency, and selenium is also low. This is an important mineral that would need to be supplemented as well. Now we can move on to the heavy metals, and as we can see here, the aluminium is pretty high, which is due to the low silicon. Silver and mercury are both very high. This is due to most commonly mercury fillings in the teeth, which would need to be removed and cleaned up. And other metals are also quite high. Cadmium here and lead are certainly ubiquitous in our environment. We'd expect to see the readings about here, but in this patient they are particularly high. And the reason for that can be found a little bit further on, where we get some information about the ability of the patient to detoxify. So here we see this patient doesn't detoxify very well, and hence the metals are at pretty high levels because the patient hasn't been able to eliminate them properly. And the next bit of information we can get from this are some important ratios. This can help with interpretation of a disease process going on. Particularly the sodium-potassium ratio relates to the ability of the sodium-potassium energy pump on the cell wall to generate energy, and in this person one would expect to find the energy is pretty low, mitochondria are probably not functioning, and one would need to address that. And the last thing we look at is the oxidative stress, where we can see the quantity of free radicals in the body measured by the oxidative aggression. This person has a very high load of free radicals and unfortunately a very low level of antioxidants to mop this up. So all in all, we get a lot of information from this OligoScan, which can be very useful for helping with chronic disease and helping with the patient to recover, get rid of the metals, get motivated to take the metals out of their teeth, and to sort out appropriate supplementation. Possibly their supplementation isn't strong enough, is not being absorbed well enough, or maybe is in excess, and all this information can be used to moderate that.